Oh, two, two. Hello all. Hello all. My name is Aracely Salas. I am in the class Foundations of Social Work Practice with Professor Greer, and this is the process of conducting a therapy session. So in the introduction to therapy sessions, we want to talk about the purpose of therapy, how important it is to establish communication and trust, and a brief overview of the therapy process. So this is something that we're going to talk about with clients when we first introduce ourselves to them and begin engaging the professional relationship. So therapy is a form of support in efforts to address challenges that clients may be facing. In therapy sessions, therapists must acknowledge the importance of the communication and the trust in the relationship, in the professional relationship. We have to talk about how we communicate and trust one another, not just having the relationship one-sided. We need to work collaboratively in efforts to help the clients meet their goals. Um, the first impressions that we make with clients is kind of the most important one because that's how they're going to perceive us for a while. So we want to make a really good first impressions when we're um, beginning these sessions with clients. And then what we're going to talk about these therapy sessions is how in the process we also are talking about um, opening the sessions, discussing the issues, planning actions, and follow-ups as well. So in the therapy process, we have assessments, goals, settings, interventions, and follow-ups. We're also going to talk about collaboration, empathy, confidentiality, and professional ethics. So a lot of this is what goes into the therapy process. But I want to keep in mind that while the therapy process is one in itself, there's many factors that go into making it effective. They're not just a one-sided thing where professionals can just say, "Here, this is what you're gonna do, fix it." It's a collaboration of two systems working together towards one goal. In sessions as social workers, we must make sure we're also being empathetic towards our clients to make them feel safe and we're able to form those trusting relationships that we need. So when we're talking about therapy, we need to realize that we need to identify that there is a need for therapy. Um, there might be signs that someone needs therapy. There's emotional, behavioral, social, or like when someone has mental health concerns. Some of these can look like anxiety, depression, trauma, family conflicts, or stress. And we also want to talk about how important it is to try for early intervention. So as soon as we notice these symptoms in people, like we can start to get them the help that they need, the support that they need. Um, yeah, we want to recognize that all clients may be in for different reasons. No clients is the same, and what will work for one client will may not work for another client. The need for therapy is going to be different. So that's based on the client, their experiences, and how they've lived. Everyone will need a different type of support. Um, some clients might need support with the anxiety, the depression, the traumas, and some might need help with other things. When we, oh, sorry. But yeah, intervention and at an early stage is important because it can be easier to provide effective support and the support needed might not be as um, heavy as or as much as if it's a lot more down the line. So when we're preparing for therapy, we need to gather background information on the client. We're gonna check their history, and we're also gonna make sure that the area, the environment that we are in with them is safe and confidential. By doing this, we establish professionalism and cultural sensitivity. We're making the space feel safe for them. We're making them safe. We're making the space feel trusting and just a space where they can feel confident in themselves. They're not going to be judged. They're not going to be looked at differently. We're going to use our active listening skills and help them reflect. And through these um, factors, we're going to be able to get them the support that they need. So we need to gather information. This can also look like referrals or forms that like you may take a client from somewhere else. So we need to look back on their background, their history. We can work with other peers, other people who may mm, have experience working with them. Um, yeah, let's see. Making sure that our space is inviting. This looks like, what does the waiting room look like? What does the even the room look like when that we're in? It needs to look it needs to feel comfortable. It needs to feel inviting and safe so that they feel supported. So in stage one, when we're building the relationship, we're building trust. And this is where we can bring in our active listening skills. When we use these, we also use empathy, and we're showing them that we're not judgmental and we're open to communication. So, when we're building trust, therapists can engage in the conversation, ask the client to introduce themselves, let them talk about themselves, and begin engaging in active listening, where we're saying, those little, even like the nonverbal, we're just looking them in the eyes, making them feel seen and heard and understood. Um, Through this process, we can practice empathy while engaging in non-judgmental communication. This stage is important to explain what sessions will look like further on. So we'll be able to tell them, all right, this is what we're gonna do in these sessions. They're gonna look like this. Is there anything you want to talk about specifically? Like this is what we're going to do. In stage two, we're going to talk about assessment and diagnosis. We're going to talk here about discussing the client's concerns and collecting any information we have. This can look like how certain stuff makes them feel, what behaviors they have towards certain things. Right here, we're going to be able to identify what strengths they have and develop an understanding or a diagnosis of what truly is going on. So we'll figure out what specific challenges the client's facing, discuss various topics, gain insight to how they feel emotionally, behaviorally, or socially, and then using their strengths, we'll be able to use those to empower them. So sort of like a empowerment-based approach where we help them feel like they are supporting themselves through what they are already good at. When we're talking about formulation of therapy goals, oh, we're using our collaborative goal settings, creating realistic and measurable goals, and prioritizing the client's needs. So here we address challenges and work as a team to set goals that are measurable and realistic. Again, realistic and measurable goals. We need to be able to set goals that they can reach. So even if that looks like one by one, If we say, today I'm going to say hi to one stranger. I'm going to say hi to a stranger on the street. That's something that they might be able to do versus today you're going to talk in front of a crowd of 50 people for somebody with who might have something like social anxiety. So little by little, we're setting goals that they can attain to, and then slowly we add on to that. We're not just gonna give them goals that we know they're not going to be able to measure um, quickly. So in this stage, we talk about putting plans into action. We're going to talk about the techniques, the interventions, the coping skills, the strategies, all the methods that we can use to help the clients. So while doing so, we're also going to make sure that clients are being monitored to measure progress and to discuss what techniques or interventions are working, what's not working, what might need to be altered. Because again, what works for one client might not work for another, or even in these sessions as well, we have while monitoring, we're going to use techniques again of social work of going back and forth and saying, yes, this worked. Oh, it's not working anymore. Let's go back and see what we can try again. We're gonna go, it's gonna, while it's a process, it's not a straight process. That's the good thing that we're able to go back and forth and see what works and what does not work. Um, when we're able to use these techniques and these problem solving methods, again, while monitoring clients, problem solving should create feelings of empowerment. Clients should be feeling like they're the ones putting in the work. While we're giving them um, the tools, they're the ones putting in the effort and the work to make better for them. So in stage 5, we have termination and follow-up. This is where we review progress, see what they've accomplished. We're preparing them for independence to be able to do things on their own. We're going to talk about follow-up sessions, continued support, and how important it is to evaluate outcomes and what like could happen, what might not happen when we're talking about setting goals. So at the end of the therapy sessions, we're gonna end the meeting by reviewing what we discussed for the session. So we're gonna say, today we talked about um this and this. And then when we're discussing what the session was about, we're gonna talk about continuing forward, what we might talk about next session. We'll review the progress that's being made and take a moment to reflect on what or if any changes need to be made. So this way the clients can be prepared to handle their channel challenges alone. We'll be able to discuss any future meetings and discuss how the session affected the client for the day, how they feel like what we've talked about will influence them until within the next few days or until their next session. So again, therapy is a step-by-step process. Um, but there's no only one way of conducting a therapy session. It's collaborative. We're gonna go back and forth with clients, not in a bad way. I mean, saying yes, this works, no, this won't work. I don't like how this would make me feel. So just it's a back and forth. It's a learning curve for both the clients and the therapists. It's more than just a step by step. It involves having empathy, knowing how to actively listen, being able to reflect the contents, their feelings, knowing how to be trustworthy, non-judgmental. Um, yeah, as a therapist, the job isn't to fix people, but it's to help them and support them by providing them with the tools they need in order to be successful and reach their goals. Yeah, thank you.